Dear viewers, I receive many questions from women about what may potentially harm a pregnancy. Is it safe to eat chocolate? Should you travel? Are certain screenings allowed during pregnancy? Every woman wants to carry and give birth to a healthy child, right? So in this video, I'll begin discussing factors that may impact a pregnancy. I'm Dr. Lena Berezovska, and I welcome you to my video channel. Don't forget to like, subscribe, and share your comments. If you're interested in pregnancy topics, keep watching. By the way, my channel also has other playlists where you can explore videos on various subjects. The fetus develops within the mother, meaning that on one hand, it's well protected from environmental influences. Many substances that enter a mother's body in small amounts are safe for the fetus because they do not reach it in harmful doses. On the other hand, the mother's body itself is an external environment for the child. Therefore, factors affecting fetal development and pregnancy progression include the mother's physical health, her emotional and psychological state, everything she introduces into her body, such as food, medications, alcohol, nicotine, drugs, the external conditions in which she lives and works, her lifestyle, work, sleep, rest, diet, physical exercise. Unfortunately, it is impossible to predict the exact impact of even seemingly minor factors. Some pregnancy complications are unavoidable and may occur spontaneously, sometimes even in healthy women. However, following specific recommendations can help prevent many issues or at least reduce their potential harm to the future child. In other words, while certain risks can be eliminated entirely, it is possible to significantly lower their probability or reduce the impact on an individual woman. In any prevention strategy, timing and management of risk factors are both crucial. Ideally, preparations to prevent pregnancy complications should start during preconception. However, if that time has passed, assessing potential risk to both the mother and the child in the early stages of pregnancy is essential. Many doctors advise pregnant women to adopt the crystal waist mode, avoiding anything that might harm the fetus or trigger a miscarriage. As a result, some women following such advice stop moving altogether, become overly restrictive with healthy eating, sometimes consuming only pureed foods, take excessive medications supposedly to prevent various diseases, and sometimes impose strict boundaries on loved ones. Don't come near, don't touch, don't breathe, don't even look. But what if the pregnancy fails? In my opinion, shared by many progressive colleagues, a pregnant woman should lead a normal life while being mindful of certain factors that could impact the pregnancy. What are these factors? If a woman has a serious illness, it is not the pregnancy that usually endangers her health, but rather the worsening of her condition, which could pose a risk to the fetus. This condition should be diagnosed early and treated cautiously, as many medications are contraindicated during pregnancy. During the first 3 weeks of pregnancy, which corresponds to 7 days after ovulation and conception, the embryo has no direct contact with the mother's body. Therefore, even relatively dangerous medications will not affect the embryo's development, except for those eliminated from the body very slowly. Once implantation begins, a connection between the mother and the child is established. From this point on, despite protective barriers, many medications and other chemicals can cross the placenta and enter the fetal bloodstream. When a pharmaceutical company states in a drug's instructions that it is contraindicated for pregnant women, this is done to avoid responsibility for potential harm to the embryo and fetus. It also indicates a lack of clinical evidence providing the drug safety for both mother and child. Such warnings should be taken seriously. In extreme cases, when a woman's health or life is genuinely at risk, medications can be used cautiously even if they are contraindicated. Until 12 weeks of pregnancy, when the child's major organs and systems are forming, even low concentrations of substances harmless to the mother can impact implantation and the proper formation of the child's organs. Between 3 to 5% of newborns have developmental anomalies, and even higher percentage of pregnancies and early due to developmental disorders and abnormalities incompatible with life. A pregnant woman should avoid overheating, as high temperatures can lead to cardiovascular defects in the fetus and, in extreme cases, result in embryo loss. During pregnancy, it is best to avoid frequent hot baths, as well as saunas and steam rooms. Also, they remain part of cultural traditions in some parts of the world. There are several types of medical imaging diagnostics, including ultrasound, X-rays, computer tomography, magnetic resonance imaging, MRI, and the newer field of nuclear medicine. Pregnant women are often concerned about the safety of these diagnostics for themselves and their baby. Some traditional physicians still recommend termination of pregnancy if the patient had a fluoroscopy or X-ray in the early stages before knowing that they were pregnant. Many women are afraid of even a slightest exposure to X-rays, such as those needed for dental treatments. It is important to understand that no diagnostic or therapeutic intervention is 100% safe for a pregnant woman. Therefore, a doctor must weigh all the pros and cons, considering strict indications and contraindications before prescribing any diagnostic or treatment methods. The less medical personnel intervene in the natural course of pregnancy, the better the outcome, as this minimizes the risk of medical errors and reduces unnecessary stress for the woman. If the examination is not urgent, it should not be conducted in the second half of the menstrual cycle, when the woman may be pregnant. Physicians are obliged to rule out pregnancy by determining HCG level in the blood in women who are sexually active and not using contraception at the end of the menstrual cycle before conducting any diagnostics. I previously discussed the impact of ultrasound on the mother and fetus in one of my videos. Occasional X-ray examinations are also necessary when considering the effect on the unborn child. It is essential to distinguish between the pre-embryonic, embryonic, and fetal stages of pregnancy. The same dose of radiation will affect the fetus differently depending on a stage during which it is administered. Modern X-ray machines are much safer than those used 20-30 years ago, and a single X-ray is unlikely to have a significant negative impact on the embryo or fetus. However, we still lack of complete understanding of how even minimal radiation exposure may affect the genetic material of the future child. Abdominal radiation exposure, especially in early pregnancy, is undesirable and should only be done under strict medical indications. Clinical research shows that embryo damage or loss are possible with repeated X-ray exams 5-10 times or more, particularly in the abdominal area. Some scientists link high radiation doses received by the fetus in later stage of pregnancy to an increased risk of cancer and mental developmental disorders in newborns and other children. The use of contrast agent and radiological radioisotope agents during pregnancy should be limited to cases with strict indications where other diagnostic methods prove uninformative. Most of these substances can cross the placenta. While they are not teratogenic, do not cause embryo death or developmental defects, they should be used cautiously. Radioactive iodine is contraindicated during pregnancy, while radioactive technetium used for examining the brain, kidney, bones, and cardiovascular system is sometimes used with pregnant patients. I will continue discussing other factors that may negatively affect pregnant women and the fetus and are not always risk-free. Join my channel to watch upcoming videos. All the best!